Right, everybody. So today I am talking about a tip for SI joint dysfunction. So, SI joint dysfunction, I have a chronic low back pain clinic, and shockingly, over the years, I have found that SI joint dysfunction, sacral torsion shear in my patients, in my clinical observation, is the most common cause of back pain, especially those that are told that, nope, we don't know what's wrong with you, insert procedure or provider. And what I have found, this is a drawing that I made, is that I colored in, you see the tops of the feet? I have a patient right now that had top of the foot pain. And I have seen this before, and I use my diagnostic method, and I open up their SI joint, and then the back of the heel, I've actually seen it too. The guy has both. Now, most people would write that off to a disc issue, right? Because it's like, oh, well, it goes into the foot. Well, it can't be SI because SI goes to the lateral ankle. No, I have not seen, I see it in the top of the foot, okay, or the heel itself, okay. So now remember, just a refresher, I published a paper that statistically made medical history called in readership called Root Cause of SI Joint Dysfunction. In there, I propose that SI joint dysfunction is caused by an upslip and or out flare of the pelvis, up out, okay? And you can verify this by pulling on the leg, bringing it back down. So they have a negative prone press up test. Okay. And then what I do is I lay them on their side. I have so many videos on my YouTube channel. Go to Welton Methods. Okay. And I open it like this. Okay. Sometimes you can't get it open just doing that. Then I have them stand up, squeeze a ball. Why? Feet together. That's very important. Otherwise, you just jam the SI. Squeeze the ball, and then because it gaps it open like that, and have them find the aggravating motion again, which is a lot of times extension, could be flexion, but a lot of times extension. And if that doesn't work with squeezing the ball, I hold both ASIS and push medial as they squeeze the ball. Okay. And that right there, if they say they're pain relieved, then you just realign their SI and they're pain relieved. Or if it came up out of their leg, and I've actually seen weakness in people's legs, which is rarely documented in medical history. I put it in my paper. With videos, I got it on video. So if you join my free school group below, click the link or go to weltonmethods.com and join my free VIP group. I have that in there, all the links to my papers. That's for clinicians only, okay? Clinicians only in that group. This is a group of clinicians, okay? Okay, listen. All right, so today I am talking about, what am I talking about? I am talking about a tip for SI joint. Okay, so I have a few patients right now that they're going up in weight. My average, I tell my average patient, you have to tell them up front. If you don't tell them up front, this long rehab process of SI joint, people are like, this is taking too long. I got TikTok brain. I want immediate gratification. This isn't happening. It's not working. I'm quitting, right? So I learned if you just warn them up front, then they're okay with it. I tell them 2 to 6 weeks to start noticing a difference, good days, bad days. And some days I say you're going to feel like, oh, wow, look at that. I feel better. The next day, next week or weeks, you're hurting again. It's normal. It's a good thing. Hold you some hours, some days, just not every hour, every day. And I send that to them on video. Why? Is because most of them didn't hear it. And people need to hear things 3 times, right? So I send it on a video. Okay. And that way there's no misconceptions when they start coming in aggravated in a week or 2 weeks or even 3 weeks, that they're like, I don't feel any difference, and it's like, well, do you remember I told you that managing expectations is one of the most important things you do in rehab. Okay. It is as important as the rehab because otherwise these people quit. Okay. They don't understand it. They get TikTok brain. They just want, well, if I'm not better in 2 days, then I'm never going to get better. It's like, what, well, we got to warn them, this is our job. Right. So, okay. Okay. Listen. So a tip for SI joint dysfunction. So I tell my patients, the average patient for adduction, okay? The average adduction weight has to be between 5 and 10 pounds. I mean, 10, excuse me, 10 and 20 pounds, okay? Some need to go higher, okay? Now, I tell my patients, don't put more than 20 pounds, use your clinical judgment. Don't put more than 20 pounds below the knee, okay? Because you could hurt your knee. Arthritis knee patients will start to struggle. And at that point, you just put it above the knee. Okay. But when you put it above the knee, you just took the lever arm away. So just know that you're not doing the weight you think you're doing. Okay. You're doing like half of that, you know? So if you got 10 pounds below the knee, and then you put the 10, and then you switch it, and you put it above the knee, it's like 5 now, right? So people think they're doing massive weight, but they're not. Okay. Now, some people have pain when they go and increase in weight. Like I got a couple of patients right now. They were at like 5 and they went to 10. They hit 3 sets of 30. So it just became too easy for adduction only. That's the only exercise you put the weight on. Adduction. Okay. And they hit 3 sets of 30 and then they jumped from 5 to 10. And when you jump from 5 to 10, some people, it irritates them. Okay. So what I say is okay, so here's what I want you to do. You're going to go slower. Everybody's body's different. Like this is our job to troubleshoot, right? And I tell them that when you hit 3 sets of 30 and you're going to go jump from like, let's say 5 to 10 pounds, right? A deduction, then you don't go at 10 pounds, 3 sets of 30. What you actually do is I want you to do 1 set at 10 and the other 2 sets of the 3 sets at 5. Okay. And you slowly, and then you work up to 3 sets at 30. So that is a common thing that happens during this rehab. It's one thing to just do my protocols, okay? But it's another thing to learn how to troubleshoot, because troubleshooting is a part of the process, right? But that's our job, okay? Is to understand what's happening clinically to our patients' biomechanics and be able to adjust accordingly, okay? So that is very, very, very important, okay? I run into that a lot, actually. I run into it a lot. People that get aggravated, when they make the jump, okay? Now, I always tell my patients that also, you should never put yourself in pain. If you are in more pain while you're doing this exercise, you're making this worse, okay? Soreness is okay, muscle soreness, okay? But pain, your body's talking to you. It's like, no, bro, this isn't good, So if you're in pain doing my SI protocol, you're hurting yourself, man. Now, one of the most common issues I see why people put themselves in pain is, if you think about it, the person usually starts off on one side with an upslip, I find in the chronic pain world in here, and then out flares bilaterally, okay? Now, when the person puts themselves in pain, it's usually because they're laying on that side, but they got jagged, shearing bone pain, right? So what I tell them to do is lay on your side and then wiggle your hips, usually forwards, sometimes backwards, usually forwards. Sometimes you got to put the foot behind when they do adduction and abduction. That's usually the one that's causing it, okay? And wiggle your hips and find a happy place, okay? So that right there is literally beyond important. Those issues right there come up a lot in SI rehab. And I have an SI joint clinic, a chronic low back pain clinic. This is what I do all day long. So anyways, but I have my free school group only for clinicians only. Okay. This is a place for us to talk, us to communicate. If you don't see the link below, you can go to weltonmethods.com and join my free VIP group. Okay. And they also have an advanced clinical mentorship where I will mentor you weekly. Okay. And then also with live Q&A. And then also I have my hybrid clinical business, cash-based clinic, where I work with you one-on-one and we transition you or open a cash-based business that is extraordinarily successful. I teach people how to make in a month what most people make in a year in these cash-based business models. So it's really, really cool. And, I see like 6 or 7 patients a day, I don't want to be that guy that, we've all been there, or maybe you're in it, where you get home and you can't even talk anymore, like you just need time by yourself, like we've all done it. And for me, I know my limit, because I got so many other balls in the air. I just like seeing 6, 7 patients a day, and it's a 7-figure model. Solo practitioner, 7-figure model, and I work 20 something hours a week. So, treating patients. So it's people say that's impossible. And I'm like, yeah, if you're doing what everybody else is doing, that is impossible. Like I don't talk people into using their insurance. If you want to use your insurance, go use your insurance. You should pay for it. But if you got a condition that nobody knows what to do about, which is I teach you how to target these people on social media with ads and the exact words they used over the years. I listened to the words they use and I created videos and I teach you how to do it, target these people. And these people are desperate for someone that has invested time in the education to go beyond the traditional into finding out what's wrong with them. And they will pay you accordingly to your clinical skills. And that is how I created a 7-figure clinic, 7-figure clinic working, 20 something hours a week. Okay. Is because these people see the value in what you're doing and they will thank you for changing or saving their life. Okay. If this is you and you want to do that, join the free school group below or go to weltonmethods.com. If you're a chronic pain patient and you want my papers, they're on my website. Okay. Under publications. All right. So that's that. When it comes to SI joint, you got to go up slow for some people. I go up with women by 3 pounds, start off with 3, or start off with 0, 3 sets of 30, just came too easy, go to 6, go to 9, 12, 15. I tell them up front, the average patient is 10 to 20 pounds in my clinic, my chronic pain clinic. And then for men, I go up by 5s. Okay, start off with 0, go to 5, 10. I outline it in my courses and all this stuff where I go much more in depth. Okay, but this is beyond important. If you don't learn to troubleshoot these rehabs, then these people get put in pain and they quit, or they get flared up and they don't understand what happened, and then they quit, So everyone from the lower thoracic, I've seen it referred into the lower thoracic and into the foot with any sciatic-like symptoms. That includes burning, tingling, weakness. I have that documented in my SI paper. Weakness. I believe I'm the first person that got drop foot from SI on video. It's been documented rarely in medical history. I looked it up, but I believe that I was the first one, maybe, in medical history to document that on video. So if you want to see drop foot relieved with an SI realignment, go and read my paper, weltonmethods.com. My papers have statistically made medical history in readership, according to AI, I pin the analytics to my social media, getting multiple times even what the biggest journals in the world get. Now, why would that happen? Even 3 to 5 years post-publication, they're still getting multiple times. And AI says these are landmark, evergreen, foundational papers, was the quote, in the field of orthopedics, and they will be forever. It said, because 3 to 5 years post-publication, like my sacral and SI paper, again, like 12, 13,000, you can see the exact analytics, something around there, reads, whereas the average paper is like 800 at that point, okay? So that's that. Other than that, for clinicians only, join my school group below, okay? And if you're a chronic pain patient and you just want my papers to take to a physical therapist or somebody, those are on my website, weltonmethods.com, okay? And I'm teaching, I'm mentoring people, everybody, I see people on Reddit, they're looking for a mentor. And like, oh, this clinic doesn't have a mentor. I will be your mentor. I will help you. I will teach you everything I know, including the advanced understandings of the body that I am pioneering, okay? So stop looking for a place that'll give you your mentor, What are the results they're producing, That's the first thing I look at. What are the results they produce? One of my kids wants to, run like a speed coach, I want to know what the results are. What's the point? The guy's a nice guy, but he's not getting results. What's the point? Why would I listen to this person? Why would I pay the money to put my kid in that? So anyways, that's that. Bottom line, what's the results? You're going to go to a PT school. What's the results? What percent of people pass the boards? If it's a low percentage, don't go to that school. You know what I'm saying? Okay, I'm out. Peace. Love you all. Join my school group below for clinicians only.